Hi everyone! This video is a continuation of our topic for this week on physical examination. You will learn how to perform general survey, to take vital signs, and to assess the pain of your patient. These are the learning objectives of this presentation. At the end of the session, the students are expected to be able to identify the components of general survey, to identify appropriate subjective questions based on initial observations or during your general survey. Demonstrate how to measure blood pressure, pulse, respiration, and temperature of your client, and describe the different types of pain. Reminder, before proceeding to your physical examination, remember to review the chart or the record of your client for you to have a basic information about your patient. Remember also to set the stage for interview or for physical examination. Prepare your materials, supplies, and equipment that you will need for your physical exam. And of course, remember to apply all the therapeutic communication techniques you have learned in our previous discussion. In doing physical examination, the very first step is to do general survey. General survey provides the examiner or the student or the nurse an initial patient assessment prior to exploring each systems in detail. Bago ka mag-check ng mga parts or the system of the human body. Okay, usually your general survey, ito yung first meet mo with the client. You will have your first impression. Okay, ano ba yung first impression mo sa client? And of course, you as a nurse, dapat maganda rin yung impression ng iyong patient sa'yo. You have to give smile to your client. Okay, that is again to gain the trust of your patient. Upon approaching your client, ano ba yung facial expression of your client? Or what is your first impression of the client? Suplado, approachable. Those are examples. Also remember to observe the non-verbal cues. Okay. Assess many factors that includes the general appearance of your client. Okay, the way your client move, is your client awake, conscious, coherent, alert, yan. Apparent state of health. Is your client looks ill or healthy? Okay, the demeanor of your client. Respectful ba si patient? Ano ba yung mood ng iyong patient? The facial affect or expression. Is it flat or unresponsive? How about the grooming? Yung hygiene ng client. Maayos ba yung hair, yung dress, yan. The posture and the gait, yung movement niya, the way your client stand, the way your client sit down. Okay. That's part of your general survey. Alright, sabi na natin, you have to observe the general appearance of your client. Okay, example, is your client awake, alert, conscious of what's happening in the surrounding, coherent, oriented to time, place, and person. And your client is not in cardiorespiratory distress, hindi siya sobrang mabilis huminga. Okay. Is your client unconscious? Unresponsive kapag tinawag mo or tulog lang ng tulog, asleep. Incoherent. Okay. Do not respond you or you cannot talk to the client. Confused. Okay. When you ask your client, where are you now? Or your client cannot give you an answer. No? Disoriented. Okay, when you ask your client what is the time, what is the date today, what is your name? Okay, what is the name of your mother, father, and etc. Looks intoxicated, ayan, smells like alcohol, or in cardiopulmonary distress. Okay, for example, okay, ito yung ating result of your general survey or your statement for general survey. So the patient looks normal. Okay, patient came to the clinic looking tired. He is awake, alert, conscious, able to mobilize. Okay, or another example. Patient came to ER unconscious, unresponsive, immobile. Yan. So another. Patient came to ER awake, incoherent, disoriented. So this is an example of your findings for general survey. So for the apparent state of health, you have to make general judgment. Okay? Is there a presence of pain? Okay? Acute pain or chronic pain? Frail or fit and robust? Weak ba si client or parang hirap gumalaw? Okay. Looks his or her age. Okay, baka sa tingin mo naman na sobrang, when you ask your client kung ilang taon na siya, sabi niya 20, but she looks or he looks at his 40. So there, it can be a sign of problem. Unhappy or happy ba si client? Fatigue or rested? Yeah, you can observe that. So that's part of your apparent state of health. And okay, so you have to assess also the level of consciousness by observing your client if your client is awake, alert, and responsive. Okay, you can call the name of your client. For example, Mrs. Chase. Okay, if your patient responds, okay, so meaning awake siya, alert siya, and then responsive siya. And then you check or assess also the orientation to person, place, and time. How will you do this? Maybe you can ask Mrs. Chase, what is the name of your father? Okay, how about your mother? Okay, so can you tell me where are you right now? Or where do you live? What is your address? Okay, so can you tell me the time at this moment, or what is the date today? So those are example of the questions that you will ask Mrs. Chase. Okay, observe also for the facial expression. If your client is at rest or during conversation, examination with others, at rest ba siya, irritable, okay? Does your client maintain eye contact? And again, it depends to the culture of your client. So if your client did not maintain eye contact, you have to assess if it is related to culture or maybe a sign of low self-esteem. Yeah. And then you have to observe also for the movement, symmetric movement. So in assessing the symmetric movement of the face, you can ask the client to smile, to frown, okay, to raise the eyebrows. Okay, that's one way of checking if the facial muscle moves symmetrically. Okay, and then proceeding, no, this is just an example of the facial expression. Okay, so as you can see in this slide, okay, look at the eyes of the client. No, this is for those who have hyperthyroidism. Yung hyperthyroidism kasi ganyan sila, no, yung protruding eyes. Okay, naka-protrude ang kanilang eyes. That could be a sign of hyperthyroidism. And another one is yung parang mask-like. Yan, so I have right, so this is another example of your findings for facial expression, no, abnormal findings, especially for the patients suffering with Parkinson's disease. There is a decrease in facial mobility, blunt expression. It is a mask-like face that may result with decreased blinking and a characteristic stare. Okay? Since the neck and the upper trunk tend to flex forward, the patient seems to peer upward toward the observer. So the facial skin becomes oily and drooling may occur. Another example of abnormal findings of the face or facial expressions, you may observe ptosis of the upper eyelid. Okay, so this is how it looks like, no? Medyo maliit yung kabilang eyes, tapos parang nako-cover ng kanyang eyebrow. Okay? To continue with your general survey, you have to observe the posture, the gait, the motor activity, and the speech of your client. So before calling the name of your client, remember to observe the preferred posture of your client. Okay, according to Bates, the patient who often prefer sitting upright could be a sign that the patient is suffering left-sided heart failure. Or if your patient prefer to sit down, no, leaning forward with an arms braced, okay, this is common for the patient suffering with chronic obstructive pulmonary disease or COPD. Okay, is your patient restless or quiet? Okay, in pain ba si client? Restless or agitated si client? Probably may anxiety, okay? Yung changes of position, is it often? Okay, lipat siya ng lipat, restless din yun. Could be a sign again of anxiety. Or if your patient doesn't move at all, maybe your patient is suffering with pain, di ba? If you are in pain, you don't want to move. Okay, you have to observe also how fast or how slow are the movements. Again, kung sobrang bilis yung movement, could be a sign of distress or anxiety. Kung sobrang slow naman ang movement, could be a sign of problem with the muscle or the or your patient suffer with stroke, diba? Okay, observe for apparent involuntary motor activity like tremors, okay, tremor, diba? Sign din yun sa may mga Parkinson's disease. Immobile or stiff joints, ayan. You have to observe also for the speech of the client when you do the interview, when you start asking the client's name, okay, and the demographic informations, okay, is the client's speech articulate, garbled, rapid, or slow? This can be a sign again if your patient is suffering for distress or anxiety, okay, very rapid yung salita niya, or very slow naman if your client suffering for depression or stroke, okay, garbled, okay, or slurred speech. Okay, baka nag-start nang magkaroon ng stroke si client, no? Mataas na palang kanyang blood pressure. Right. So this is an example of yung sinabi ko kanina, no? For those patient who suffer chronic obstructive pulmonary disease. So this is what we call the tripod position. So nakaganyan siya, no? Leaning forward with the arms braced, no? There are some studies kasi that this helps, okay, this helps the breathing of the client suffering with chronic obstructive pulmonary disease. Ibig sabihin, nakakahinga sila kapag ganito yung kanilang position. Moving on to our general survey, you have to observe also the odors of the body and the breath of your client. Okay, mabango ba si patient? Does your patient smell alcohol? Okay, kapag na-smell mo yung alcohol, maybe you want to use your gauge, no? Yung assessment kung yung patient mo is alcoholic ba. Okay? Or does your patient smell like acetone? This could be a problem of those patients with diabetes, no? Pwedeng acetone, pwede rin alcohol yung amoy niya. Or yung mga patient with pulmonary infectious, iba rin yung naaamoy mo, yung uremia, liver failure, okay? Fruity naman yung amoy din ng mga patient with diabetes. Moving on to our general survey, you have to assess also the skin color. Is the skin color uniform? What is the color of the skin in the exposed area? and the covered area? Are there obvious lesions? This will be discussed further in our next discussion. Okay, observe for the dress, the grooming, and the personal hygiene of your patient. Is the clothing appropriate for weather? Okay, baka naman naka-coat si patient. This could be a sign of cold intolerance for those patients suffering with hypothyroidism. Okay, may cold intolerance sila. So, naka-coat, naka-jacket, or naka-sweater sila. Or, for the psychiatric patient, baka meron siyang mga hinahide na scars dyan. Yung may mga suicidal attempt. Yan. Tinatago niya yung mga scar. Or baka may mga bruises, may mga marks of abuse. Okay? You need to explore, okay, on that part. Okay? You need to ask the patient the reason why he or she is wearing coat or jacket. Okay? Is the clothing clean and properly buttoned? Okay. For patient with depression, usually neglected yung kanilang ang kanilang dressing or ayaw na nilang magbihis. Okay? Ayaw maligo. 'Di ba? Kayo ganyan din naman kayo pag nade-depress kayo, pag iniwan kayo ng girlfriend, ng boyfriend ninyo, ayaw niyo nang bumangon, ayaw niyo nang kumain. Ayun. So, properly buttoned ba yan or wala na siyang pakialam? Okay. Or sign of, could be a sign of dementia na hindi niya na matuntun paano ayusin. The clothing appropriate for age and or social group. This will reflect the social preferences of your patient. Or again, baka naman yung clothing niya is pang 1920s pa. Okay, nasa 2020 na tayo ngayon. So this could be a sign of dementia. Yan. May presence ba of tattoos, piercings, yan. The hygiene and the grooming, appropriate for age, lifestyle, and occupation. Appropriate ba ang kanyang? Nag-o-office siya, tapos papasok siyang parang hindi nagsusuklay. Okay, that could be a sign, again, of depression or anxiety. So part of your general survey is to observe the signs of distress. Okay, particularly for cardiac and respiratory distress. So check if your client experiencing a chest pain, especially meron siyang clutching of the chest or pallor, okay, pale, namumutla, diaphoresis, or meron siyang excessive sweating, labored breathing, shortness of breath, or naka-tripod position si client. Could be a sign of, again, COPD. Okay, is your patient experiencing pain? How about the facial expression? Makikita mo naman yung face ni client if your client is in pain, grimacing, crying. Yan. So, is your client experiencing anxiety or depression? Okay, you can observe it. Okay, meron siyang anxious face, fidgety movements, poor yung kanyang eye contact, flat affect or unresponsive, psychomotor slowing, mabagal ang kanyang movement, cold, moist palm. Okay, that's a sign of anxiety or depression. This is an example of your normal findings. Okay, the patient is awake, alert, coherent, oriented to time, place, and person, mobile, and not in cardiorespiratory distress. So, another example of your first impression general survey. So, dyan pa lang kitang-kita mo that the patient is bleeding. But I think the patient is responsive kasi nakaupo naman siya, meaning the patient is not unconscious. Okay? The patient is awake because if your patient is unconscious, of course, it should be lying on the stretcher. So, that is an example of your first impression. Okay, let us proceed to vital signs taking. Remember that vital signs are the integral part of your physical assessment. This includes the blood pressure, the heart rate or the pulse rate, the respiratory rate, and the temperature. So there are 4 vital signs. But according to Bates, a pain is considered as the 5th vital signs, but it depends to the hospital setting, clinical setting, or any institution. Okay, some institution or hospital might choose the oxygen saturation using the pulse oximeter or the glucose test or the Glasgow Coma Scale as the 5th vital sign. So again, it depends. Okay. Again, vital signs is an integral part of your physical assessment. It is usually checked in the beginning of your assessment. You can recheck during system assessment if not within normal parameters. Kung may abnormality kang nakikita. Consists of, again, blood pressure, heart rate or your pulse rate, respiratory rate, and the temperature. In taking the blood pressure of your client, make sure to choose the correct size of your sphygmomanometer. Because if the cuff is too small or narrow, the BP might read high. If the cuff is too large or wide, the BP will read low on small arm and high on large arm. So ensure equipment is functioning correctly and in good repair. Of course, for you to have an accurate reading. So para maiwasan po natin yung misdiagnosis. This figure shows the top 20 causes of mortality or death in the Philippines, okay, from January to June 2020. Okay, the first leading cause of death is the ischemic heart disease, and it is followed by cerebrovascular diseases. Okay, your hypertensive diseases are ranked number 6. Okay, but in America, according to the Book of Bates, 80 million of Americans have elevated blood pressure. So, monitoring the blood pressure might help our patient or might help the client to prevent further complications and proper treatment. So these are the examples of our sphygmomanometer. Okay, the first one is the smallest. No, this is for pediatric. Okay, and the medium size and the large or extra large size. Okay, that usually yung large or wider is used for the thigh or for the obese patient, of course. So this slide shows the parts of your sphygmomanometer and the parts of your stethoscope. So for your sphygmomanometer, it should have the pressure gauge that is functioning well and the artery alignment mark that will be placed on top of your artery or artery of your client. Okay, and then the cathode bladder or bladders, the pressure control valve wherein you have to adjust, okay, to inflate or to deflate. Okay, so this is the valve, no, and the tubings. Parts of your stethoscope includes the earpieces. No, it has 2 earpieces, the ear tube, and the tubing, of course. This the stem and the bell of your stethoscope used to hear lower pitch sounds, especially for the heart murmurs or adventitious sounds of the heart, lungs, and the abdominal sounds. And the diaphragm, this is used to hear a normal heart sound and lung sound, or for higher pitch sounds. So these are the steps to ensure accurate blood pressure. Okay, so I'm sure you have the ideas or knowledge about how to take blood pressure. because you have discussed it already in your RLE. Okay, remember to instruct the patient to avoid smoking or drinking caffeinated beverages for at least 30 minutes before BP is measured. Because we know that smoking or caffeinated beverages may constrict the blood vessels and you will have a false reading or inaccurate result. Check to be sure room is quiet and comfortable. Ask patient to sit quietly for at least 5 minutes in the chair, lalo na pag bagong dating si client. Select arm. The arm should be free of clothing. No arteriovenous fistula for those patients undergoing dialysis, no? Make sure to check kung meron silang AV fistula. Scarring from previous arterial cut-downs, edema, or may mastectomy. So, kapag may mastectomy si client, right side, you can take the blood pressure on the left side. Okay? And then, palpate the brachial artery for viable pulse. So, in the next slides, there will be a video presentation of how to take blood pressure. Position the arm so that the brachial artery is at the heart level. Remember that if below heart level, the reading will be higher. If above heart level, the BP reading will be lower. So if patient is seated, rest the arm on a table a little above the patient waist. Look at this picture on how to place the cuff properly on the client's arm if you are taking for blood pressure using the arm of your client. Okay, you have to place the cuff at least 2.5 inches from the elbow, and then you can place the diaphragm of your stethoscope on the brachial artery. So part of your blood pressure taking is to teach your client how to monitor their blood pressure at home. So this is another example or another figure of how to properly place the cuff or your BP apparatus on the arm of your client. Okay, so this is the ulnar artery, the radial artery. You have to position your stethoscope here, which is the brachial artery, and this is the cuff. Again, this is 2.5 away from the elbow. Okay. So what is blood pressure? Kanina pa natin pinag-usapan ng blood pressure. Remember that your blood pressure is the measurement of the pressure on the walls of the blood vessels, and it has systole and diastole. So the systole is the pressure in the arteries when the left ventricle contracts, okay? While the diastole is the pressure in the arteries when the heart muscle rest or relax and refills with blood. So ito yung first reading and the second reading mo. Moving on to the procedure of measuring your blood pressure, remember to position the cuff and the arm at the heart level. Then estimate the systolic pressure and then add 30 millimeter per mercury. So how will you estimate the systolic pressure? By palpating the brachial artery, and then you inflate, okay? You inflate the cuff, and then you observe kung kailan mag-stop yung brachial artery pulse, and then you can add 30 millimeter per mercury. For example, nag-stop siya at 100, so you have to add 30 millimeter per mercury. And then you have to position the stethoscope over the brachial artery. Identify the systolic blood pressure. Average 2 or more readings. Okay, so pwedeng ulitin mo yung readings at least 2 minutes apart. And then measure blood pressure in both arms at least once. Ayan. So at least once to compare, no, both arms, right and left. Of course, if there is no problem with the other arm. Okay, walang mastectomy, walang AV fistula. These are the links on how to properly measure the blood pressure, including the correct cough sounds and etc. So these links will be posted in your canvas. Moving forward to our blood pressure taking. Alright, so there is what we call the auscultatory cup, which is the silence between the systolic pressure and the diastolic pressure. Okay, the unrecognized auscultatory gap may lead to serious underestimation of systolic pressure. So you have to take note of that. You might need to repeat or the blood pressure taking, or you can take the blood pressure in the other arm. Okay, so this figure shows the effect of the cuff on the arterial blood flow. When you inflate the cuff, the artery is occluded. There will be no flow, so there will be silence. And then once the artery is compressed, the blood flow is audible. You can hear sounds of turbulent flow, correct cough sounds. Okay, that will be your systolic pressure. Hanggang sa lumakas siya, hanggang sa unti-unti siyang mawala. Okay? That will be your diastolic pressure bago yung silence talaga. Okay? During this time kasi, the artery is not compressed kasi nag-deflate ka na, the flow free and inaudible na siya. So, there will be silence. Okay. So, there are errors that might result in false high readings. Okay, especially when your calf is too small or narrow, or the calf is too loose or uneven, di maayos yung pagkalagay, or the arm is below a heart level, or the arm is not supported. Okay, inflating or deflating calf too slow. Okay, it may lead to high diastolic, no? Sobrang slow yung pag-inflate and pag-deflate mo. Deflating calf too quickly, sobrang bilis naman. So it might give you a result of low systolic and high diastolic. Okay, so this figure again show how to uh, position your client, no? Choosing the correct blood pressure cuff size. Okay, these are another examples of how to take the blood pressure of your client. The Joint National Committee on Prevention, Detection and Evaluation and Treatment of High Blood Pressure identify the following, no? Pressure or blood pressure classification for adults older than 18 years old. These are the category. Okay, for normal, you have the systolic of 120 or less than 120 millimeter per mercury, and a diastole of less than 80 millimeter per mercury. For prehypertension, okay, the systole range from 120 to 139. For diastole, it range from 80 to 89. And then for hypertension stage, okay, meron tayong stage 1, no, for the age equal or greater than 18 but less than 60 years old, or for those diabetes or client with a renal disease aging more than or equal to 60 years old. The following are the ranges of the systole. Okay, 140 to 159 or 150 naman for the client suffering with a renal or diabetic client, 150 to 159. Okay, diastole ranges from 90 to 99. Yan. For stage 2, for hypertension stage 2, greater than or equal to 160 millimeter per mercury ang kanyang systole. For diastole, equal or greater than 180 millimeter per mercury. So these are the classifications. Okay, for low blood pressure reading, this will be interpret a relatively low levels by comparing to past readings and current clinical condition. Ano ba yung current clinical condition of the client? Ano yung previous niya na blood pressure? For example, a pressure of 110 as systole and 70 millimeter per mercury as diastole would usually be normal, but could also indicate a significant hypotension if the past pressure of your client is higher than that. Okay? So we have what we call the orthostatic hypotension. This refers to the drop in blood pressure noted when the patient moves from a lying to standing position. So merong difference yung kanyang blood pressure kapag from nakasupine siya at bigla siyang tatayo. There will be a drop in systolic reading of at least 20 millimeter per mercury and a drop in diastolic reading of at least 10 millimeter per mercury when your patient is on standing position. Alright. Okay, please note of the following special circumstances when you are taking the blood pressure of your client. You might experience a weak or inaudible correct cough sounds. Do not panic. Okay, try to check the placement of your stethoscope. Okay, maayos ba? Nasa brachial artery ba siya? Or, nakatouch ba siya sa skin of your client, or baka makapal yung clothing of your client, hindi mo tinanggal, or you might consider a possibility of shock. So try to check other signs of shock. Is there a presence of arrhythmias or irregular rhythm? Okay, try to check if you're checking the pulse rate, tapos you observe an irregular rhythm. You might want to check the epical pulse or the heart rate using your stethoscope on top of the fifth intercostal space on the apical area. Okay? So, we have what we call the white coat hypertension. Ito yung, for example, yung patient kapag nasa hospital or nasa clinic or sa office ng doctor, tumataas yung kanyang blood pressure. While kapag si patient is at home, within normal naman ang kanyang blood pressure. This is what we call the white coat hypertension. So maybe your client is just stressed, okay, or kinakabahan, or because of anxiety. Yan. Try to relax your patient and re-measure later during your visit. For the obese or very thin patient, make sure to use correct size of a cuff. Okay. For example, for a obese patient, you can use a cuff with at least 15 centimeter in width. Okay, kung hindi pa talaga kaya, malaki pa talaga yung kanyang braso, you can consider using the thigh cuff, no? For a very thin patient, you can use the pediatric cuff. Okay, so continuing with our special circumstances, so yung mga nasa example natin in the previous slide, or the usual location of taking your blood pressure is through your arm, diba? Just in case both arms, sa kabilang arm, merong mastectomy, and on the other arm, merong AV fistula. So there are other location, no, where you can take the blood pressure. Okay, you can use the arterial artery, okay, wherein you have to position the lymph of at the level of the heart, place his cuff above the wrist, and auscultate radial artery. So you can see the location or the placement of your stethoscope. For, in case hindi pa rin talaga pwede dyan, so you can use the popliteal tibial artery. Okay? So you can place the cuff above the malleoli or at the mid-calf. Then auscultate either the posterior tibial artery or the dorsalis pedis artery. So the dorsalis pedis artery is located here, and the posterior tibial artery is here. Okay. Pag wala naman talaga yung foot, okay, you can use the leg of your client. You can place the cuff here, and then you can place underneath the stethoscope, okay? Looking for the popliteal artery. So, place the cuff above the knee and auscultate the popliteal artery. Okay, so this is the usual, no? Yung usual na ginagamit natin, the brachial artery. So the hypertensive patient with unequal blood pressure in the arms and legs, okay, you have to compare the BP in the arms and legs. Okay, compare volume and timing of radial and femoral pulses. Okay, this could be a sign of coarctation of the aorta and occlusive aortic disease. So there will be hypertension in upper extremities. Mataas yung blood pressure sa upper extremities, low yung blood pressure in the legs. Okay, there is a diminished or delayed femoral pulses kapag the patient experiencing coarctation of the aorta and occlusive aortic disease. Thank you. This is actually the end of the part 1 of our second video or presentation for this week. So, mayroon pa rin continuation, the part 2 of your physical examination. So, we will talk about how to take a pulse rate or heart rate, respiratory rate, temperature, and how to assess pain in the next video.